I'm Dr. Pre, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. I want to talk to you about the different types of non-traditional medicine. All of these here are coming up these days in social media as more and more people are searching for a better experience in medicine. First, let's go through the criteria and what these actually mean. Let's first column here on the left-hand side. Evidence-based. That means that the protocols that the doctor follows are based on studies and, whenever possible, studies that are performed and set up in a good way, randomized controlled trials being the gold standard there. Then, when you don't have good data, you go to studies that have reasonable types of evidence, where we can be not quite as confident that this is a finding that will be reproduced in the patient sitting in front of you, but we're pretty confident. Then they look at physiologic principles to make decisions. And before making any claims as to what a certain compound will do, what a certain blood test means, what kind of risk someone has based on their profile, they will make sure that they have reviewed the literature and really make claims that are commiserate with the literature, right? So if there's not great evidence for something, they're not going to say, oh yeah, this is definitely how it works. They'll say, it might work this way, but we don't have the best evidence for it. So we're not 100% sure. Being able to say we are not sure is key, because the reality is we're not sure about a lot of things in medicine. Addresses the root cause. That means we're not just trying to patch up a symptom. Oh, you have some back pain, let me give you a painkiller. We're going to really try to understand, oh, maybe you're not flexible. So let's work on your flexibility and really get to the root cause of the issue. And most forms of medicine don't do this because they're not trained to. Even if they want to, even if they now have the time to, as we'll see in concierge medicine, they've just never been trained to think that way. Proactive, that means having a set program, checking things before there are symptoms, or checking them at an accelerated pace. Preventative, that means when there's an issue, you intervene, but you define an issue as something that means you're headed in that direction. So let me give you an example. We want to intervene on your cholesterol before you have significant plaque. We want to go get a coronary calcium score or a coronary CT angiogram to see what's going on in your arteries before you have chest pain, right? So we are intervening, we're doing things earlier than we would otherwise, both diagnostically and treatment-wise. Finally, customized is that they really tailor that treatment plan, that diagnostic plan to the person, because when you do that, it's much more likely to work. Why wouldn't you customize it to your patient? Well, because it's difficult. It takes a lot of work to do that. It takes a lot of effort. It's operationally more complex. It's educationally more complex. You might have to do things differently for different people. You might have to go and learn something that is a nuance that applies to one patient, but may not to your other patients. And all of that work makes friction. People don't necessarily want to do that. I have longevity medicine with green check marks going all the way down. And that's because this is how I think real medicine should be done. I think this is what the future of medicine will look like. And I think that when it's all said and done, all forms of medicine will shift towards this, because it will lead to better outcomes and be a much better experience for patients, who ultimately are going to be the ones that drive how this moves going forward. So traditional medicine is evidence-based. This is traditional Western medicine. Evidence-based if you're lucky. I say that a little bit facetiously. It is evidence-based, but a lot of traditional doctors don't have time to keep up with the latest evidence. One thing I've noticed with longevity medicine is that it typically takes 10 years. I'm not joking, 10 years, a full decade, before new evidence that comes out in, say, cardiology or nephrology or GI, and it makes it all the way down to the primary care doctors, who are the ones who are really taking care of patients, the large populations of patients. So it's 10 years. That is a really long time. Traditional medicine, yeah, it's evidence-based, but how old is the evidence? Is it up to date? Usually not. They also don't have enough time to address the root causes of issues. They're not taught to be proactive. They wait until there's an issue. That's how the healthcare system was set up. Back in the day, 50 years ago, you just had infections and broken legs and things like that doctors were fixing. That's why the system is meant to be reactive. And now it's really entrenched with all the payments and the education, literally everything. Proactive is a tough one, probably the biggest one that people want differently. It's also not preventive. All these guidelines are based on intervening when it makes financial sense to do so because the insurance industry is so large and dictates how care is done. And finally, it's not customized. They don't have the time to customize medication. They have 15 minutes with you. You've all experienced this. That's why traditional medicine really only gets the check mark on evidence based. And honestly, that could be an asterisk. Consumer longevity. What do I mean by this? Consumer longevity are things like Whoop, Aura Rings, Brian Johnson's Blueprint Protocol. They are things that you do not require a doctor for. I would even put Function Health into this category a little bit, although they have a doctor on the back end, which is why you're able to get blood work done. And consumer longevity, they know what people want. These are consumer businesses. So they really emphasize being proactive, which is great. That is what people want. People want to stay healthy. They don't want to wait till they're sick and then do something about it. But it's not evidence-based because almost by definition, the things that are available to consumers are typically don't have a ton of evidence around them, like a lot of these supplements, a lot of these population level studies. There's reasonable evidence, but it's not great, although a lot of them make sense. So you can still get a lot out of it, of course. It doesn't typically address root causes of problems. It's somewhat preventive, although I don't really give it a great preventive score because you need data to be preventive, and you can't go get a calcium score, for example, through consumer longevity. And it's certainly not customized. You need to be really individualize a treatment, and they're going for mass market. So it's typically not customized. By the way, you may disagree with me on some of these, and I would love to hear it. Probably could make a V2 of this chart and update it, but this has been my experience. Concierge medicine. What does concierge medicine mean? This is when a doctor gives you a better experience. Okay, it doesn't mean it's better medicine. It doesn't mean they have better protocols. It just means they're going to finally sit down and spend time with you. They'll listen to you. They'll make you feel like they are actually giving you attention because they are actually giving you attention. And it tends to be evidence-based because it's the same doctors who are doing traditional medicine trained the same way. It's very similar in that way. They may be a little bit more up to date with the evidence because they have more time, but they may not because, again, that's not really part of your training. Not a lot of incentives to do that. They don't typically address root causes because that's not what doctors do, as we talked about, not the traditional doctors. They're not trained to do that. They do tend to be a little bit more proactive, though. They'll have more time to visit with you. And if you reach out to them, right, consumers want proactive things. Humans want proactive health. They want to stay healthy. So you'll reach out to your concierge doctor and you'll get an answer from them. They're not very preventive because they're trained in the traditional system, as we talked about, and they don't really customize their care, again, because they're trained in the traditional system. They could do that, and some of them do, probably the best ones, but generally, you're going to get white glove service on the exact same thing that you get in traditional medicine. Functional health. This is one that's been out there a lot more lately, an interesting one. So functional health is evidence-based. Well, I should caveat that there are some functional health providers who are trained physicians and they go through the same training. They just prefer to practice a different style of medicine. Some of them don't have any kind of credentials or training. So you have to look into that. I'm talking about the ones who are physicians, though. And they could be nurse practitioners or physician's assistants, but they go through a standard traditional training, but then they additionally get functional medicine training or functional health training. So they do tend to be evidence-based. However, a lot of what they do will go beyond evidence. So they'll be in situations where they don't have a lot of data to back their protocols off of, which is okay. We do that in longevity too. They do address root causes. That's the key here. But they're not very proactive. They're usually waiting until you have some kind of a disease that was not able to be solved by the traditional system. That's when they'll tend to jump in and help out. They're not preventive for that same reason. And their care is probably a little bit more customized, but they tend to follow just the similar algorithms that they've had. And usually by the time somebody comes to them, they are having so many issues that they will just kind of do whatever. That's not a bad thing. They're really there to help you solve really tricky, hairy problems. Lastly, longevity medicine. When this is done properly, it is evidence-based. It addresses the root cause of problems. It's very proactive. We are trying to keep you healthy and catch things super early before you even notice them, and then keep you healthy by intervening right away. That's what it means for it to be preventive and highly customized. For this to work, it has to be really customized to that patient.